It's been a year since Singapore recorded its very first imported COVID-19 case. Local transmissions soon emerged 2 weeks later. Since then, there have been over 59,000 cases in total. In today's SG Pulse, Cheryl Goh finds out how life has changed for two patients who have recovered.
Then some days I just cry. I just cry.
29-year-old Siti Khatijah had contracted COVID-19, but unfortunately, she wasn't the only one in her family to get it.
Day after day, I got the news that, my mom, my dad, my younger brother.
Her father was the first to test positive. She was next in line. Slowly, one after another, her mother, two siblings, sister-in-law and former helper were all infected as well. It was an extremely tough period, but they kept each other going.
So we keep in touch, we video call, we played online games, to get video call online games, right? But some days, some will just switch off their phone. There are days where we just wrote down.
The customer service officer spent a total of 38 days at the National Centre for Infectious Diseases and Gleneagles Hospital, away from her husband and two children, including a 5-month-old baby.
I don't know if my husband can cope with my toddler and a baby. So my mind was just too much on my plate.
In the past year, there have been over 59,000 COVID-19 cases in Singapore. Of these, 29 patients died from the infection, which means that the vast majority recovered from their brush with the disease and lived to tell the tale. Jenny Liu is another COVID-19 survivor. The 55-year-old loves to sing and attends weekly classes, but that also led her to getting COVID. Her teacher had attended a dinner gathering at Joy Garden and was part of the SAFRA Jurong cluster. It resulted in 7 people from the singing class getting infected.
You cannot say angry to the teacher or angry to anyone. You cannot say like that. This is because maybe your health is not strong enough to fight with the virus. The X-ray said that my lung got a white dot, means that it's a COVID, the virus inside. Only few days I recover. I don't have headache, I don't have cough, I don't have anything. No symptom at all.
Ms. Liu was more concerned if she had infected her family, especially her elderly mother. Thankfully, she was the only positive case in her household. Ms. Liu says her experience has made her more aware and conscious about personal hygiene. Both Ms. Siti and Ms. Liu are now back in the pink of health, having made full recoveries. But not all patients are as lucky.
Some people call it post-COVID syndrome or long COVID. It is still a term that is relatively ill-defined. So in other words, it can represent many things. It can be very mild discomfort experienced by some of the patients, or it can be a very severe debilitating disease described by some of the patients. Some of them may experience some mild symptoms like a prolonged period of fatigue or aches and pain, but most of them resolve significantly.
Prof. Liu added that while such cases are rare, NCID will continue its research on the longer-term effects of COVID-19.